Mr. Speaker and honorable members, I arise again today to provide COVID-19 public information and guidance. Unfortunately, there is evidence of increasing COVID-19 infections in the community. However, the good news is that we are in a better position to manage the outbreaks because of the high vaccination rates and a less deadly virus strain. Mr. Speaker, I want to remind the public to continue taking precautions to avoid catching and transmitting COVID-19, such as practicing social distancing, good hand hygiene, respiratory etiquette, including washing your hands frequently, covering your mouth and nose with a bent elbow or tissue when coughing and sneezing, and disposing of the used tissues immediately. Mr. Speaker, if you suspect you have COVID-19 symptoms, take a home antigen test or contact your healthcare provider. Regardless of symptoms, if you test positive for COVID-19, you should isolate for a minimum of 5 days from the positive test date. Close contacts of persons who have tested positive for COVID-19 should monitor their health for symptoms and test for a minimum of 5 days from the date of last exposure. And individuals can contact their healthcare provider for further guidance. Additional precautions may be required in certain settings, including but not limited to schools, long-term care facilities, etc. Mr. Speaker, most positive cases of COVID-19 are not reported to the Ministry of Health with the increased use of self-testing in the community. However, the Ministry of Health can monitor trends based on what is reported from select healthcare providers and facilities, including BHB, and monitoring of outbreaks in schools, long-term care facilities, and other individual sites. Reports through this mechanism that I've just described, insofar as surveillance systems, indicated the following, Mr. Speaker. The number of cases reported in May doubled compared to April, but remained less than the number reported in March. There was an accompanied significant increase in hospitalizations in May as compared to April and March. This increase appears to be continuing through these early days of June, with a few patients currently receiving treatment in hospital, and there have been no ICU admissions. Mr. Speaker, as reported, there was a COVID-related death in March and one additional death in May. There have been 8 recently reported COVID-19 outbreaks among long-term care facilities, schools, child care facilities, and another identified site. 3 of these outbreaks have been resolved, and the others are still ongoing, with the individual sites having advised those concerned in accordance with guidance from the Epidemiology and Surveillance Unit. Individual sites may consider additional precautions based on their own circumstances. Mr. Speaker, COVID-19 vaccines will become available in the autumn. However, COVID-19 antivirals and therapeutics, Paxlovid and Molnupiravir, are available now in Bermuda by prescription only from your physician. Oral antivirals stop the virus that causes COVID-19 from making copies of itself in your body. They have been taken by millions of people and successfully treat mild to moderate COVID-19 in persons at high risk of becoming seriously ill. These pills can help people infected with COVID-19 avoid hospitalization or death. Paxlovid and Molnupiravir are available to the following patients, Mr. Speaker. Paxlovid, adults and children 12 years of age and older, weighing at least 88 pounds or 40 kg, who are at a high risk for getting very sick from COVID-19 and have mild to moderate symptoms. Molnupiravir, which is for adults 18 years and older who are at high risk for getting sick, very sick from COVID-19 and do not have access to other COVID-19 outpatient treatment options or other options that are inappropriate for them, or who have mild to moderate symptoms. A doctor can check your eligibility for oral antivirals and prescribe them if appropriate. Oral antivirals are taken as soon as possible after testing positive for COVID-19, no later than 5 days after your first symptoms appear, and these pills are taken at home 2 times a day for 5 days. Mr. Speaker, the reporting of COVID numbers ceased on the 31st of March 2023 as indicated on the government website. Summary updates on COVID-19 and other conditions under public health surveillance can be found at www.gov.bm/health information. This page is updated weekly on Wednesdays, and although it does not report specific COVID numbers, it does provide an indication of whether the country is experiencing an increase in cases. Again, Mr. Speaker, I want to encourage the public to continue taking precautions to avoid catching and transmitting COVID-19. Thank you, Mr. Speaker.